Right now, delighted to welcome to the show the Shadow Health Secretary, Labour MP John Ashworth. Good morning to you.
Good morning.
Good morning. Thank you very much indeed for joining us. I must ask you about the testing availability now. Obviously, we know that the Health Secretary promised this 100,000 tests a day target tomorrow. Testing now available to some 25 million Brits, people in England, actually, in terms of care home residents and over 65s, people who have to go out to work. Do you think the Health Secretary is now going to reach that target? And does it matter if he does or he doesn't?
Well, we hope he reaches that target because we've long been calling for testing to be scaled up. Testing and what's called contact tracing, which is where you get in touch with everybody who's been in contact with someone with the virus, is absolutely vital to containing the spread of the virus. That the countries who have been successful, South Korea and Germany, that is what they are doing. So we've been calling for this for some time. So we hope he meets his target, but we do need to get this testing into care homes and nursing homes for staff and residents because the numbers of deaths in care homes is absolutely devastating.
And do you think that care homes have been left behind? A lot of allegations, lots of claims that they have been forgotten, and they've. And we spoke to the Chief Executive of Care England, Professor Martin Green, who said that they should have been prioritised from word go.
I think that's right. If I look at it like this, I mean, the NHS with setting up Nightingale hospitals, clearing beds, getting ventilators, getting retired staff to come back. The NHS managers have done a good job in a short space of time. But I don't think we've had the same level of direction, of preparation from the top, from government on the social care sector. And we know now that the social care sector, like nursing homes or the people who go into people's own homes to help them, this really is the front line now in this battle with this virus. And the rising death toll is an absolute tragedy, absolutely devastating. Over 5,000 deaths, we think, in care homes. And of course, there's a time lag in those deaths. There's probably likely to be more deaths in care homes. This is all our grandmas and granddads and aunties and uncles. And we've really got to get in place some proper protections in our social care sector now.
Oh, look, this is something that I've been speaking to the Health Secretary and other ministers about for a number of months. Because I'm like many people have a relative in a care home and therefore have known what's happened on the ground. However, it's much easier to direct a few hundred hospitals, isn't it, when they are centrally controlled by NHS England, as opposed to controlling some 20,000 different care homes, largely privately owned with 400,000 residents. It's a very different matter, isn't it?
It is. It is difficult, but we really think that given that there's so much going on in the social care, so many issues in the social care sector where these people desperately need protection, that we really need to have a proper plan. So we've got to get testing rolled out. We've got to get the PPE to the front line. This really is vital now.
Well, indeed. I mean, the PPE is an ongoing issue, isn't it? And there's been some claims that actually the government, when they've claimed we've got a billion, we've distributed 1 billion items of PPE, that includes things like one glove counts as one item, another glove counts as a second item, and perhaps not being quite as open with us about what those items actually include. Do you think that the government is now on top of the issue of PPE, and that they like other governments around the world, are facing that worldwide shortage, a failure of packages coming from China, or they're actually not usable, they're not actually safe to use, and that they are now on top of it, and we're not going to be seeing anyone dying working on the front line of the NHS because they haven't got protective equipment. Are you confident of that now?
We need to have the details from government. Ministers keep saying that they're getting more PPE to the front line, but we still have a mismatch with what actually goes on or what we hear from the front line, and we know that our care staff desperately need this PPE. So we'll keep asking ministers to give us the details, and we hope that ministers can reassure us that PPE is getting to the front line.
And in terms of the exit strategy, we are seeing countries around the world, in New Zealand, Australia, coming out of their lockdowns. France say they're going to come out on the 11th of May, but with face masks. We'll talk about that in a moment. Spain, the end of June, they're looking at. Germany, though, are just a week after releasing some aspects of the lockdown. They're already having to reintroduce them after infections rose. This is going to be the big risk, isn't it, coming out of lockdown too early. Your party constantly calling for the exit strategy to be published. Is it possible for us to know what the exit strategy is before we can learn the lessons from other countries?
Well, I think people just need more details so we can plan their lives and understand where we're going next. So I would say a big part of what needs to happen next is testing and tracing. But we also need to know if are schools when are schools likely to go back, or what are we going to do to support businesses? Can businesses open? We understand that we have to be in this lockdown for some time, and we've all got to make sacrifices. But I think other countries around the world are giving their citizens more details, and I think it's not unreasonable to ask for our government to give our citizens more details.
Okay, it would appear from the press conference last night at Number 10 that the government has quietly relaxed one of their 5 rules for easing the lockdown. The 5th rule, having confidence that there would be no risk of a second peak of the virus, it was changed now to avoiding a second peak that overwhelms the NHS. That's quite a relaxation, because we know the NHS hasn't been overwhelmed. We know, all these Nightingale hospitals lying empty, thankfully, lots of ventilators and staff still available to do the work. So do you think that makes it more likely that we will see an exit from the lockdown sooner rather than later?
Well, it was interesting that they seem to have changed their criteria. We need to understand why they've done that and what is going on there. So that's something that we'll be asking ministers about, and we hope they can give us a convincing explanation.
Okay, just finally, masks. Nicola Sturgeon, the First Minister of Scotland, announced yesterday that she would be advising that people wear masks in public places such as shops and on public transport. Do you think it's only a matter of days before the British government, UK government as a whole, advises that we all wear masks out in public?
Well, again, there's increasing amounts of evidence which suggests that masks are a vital tool in fighting this virus. We have not had the same suggestions or advice from the UK government as we've had from the Scottish government, but I think it's probably heading that way. But one of the things we've been asking government is, if you want to start wearing masks, have you got it? Because we've seen that there isn't, or how you stockpiling the masks, will people be able to access masks? And the government need to, if they're going to tell us to wear masks, need to make sure they've got a plan in place for everybody to be able to get a mask.
Yeah, this is a small point worth making. I was looking on Amazon last night. Some delivery's not available until mid-June. Not much use right now.